All right. Kevin, can you hear me okay?
Yeah, I got you, Ian.
Okay, we're going to get started with John Vogel here first. John, go ahead when you're ready.
Hi, Kevin. First, I guess
Hey, John.
Yeah.
You know, sorry, Chris has.
Yeah, sorry. I didn't mention this to Ian, my bad. Kevin's going to have a quick opening statement, and then we'll go to you for the first question, John.
Okay.
Yeah, no, sorry, John.
No worries.
I guess just first of all, hello to everyone. I hope you guys are all doing well. I think it's important that I start by saying I've been really proud of our players and staff, and since day one of training camp, how they've been following the protocols, really been disciplined. Certainly our staff's gone way above and beyond, putting every measure in place that we can to protect our players. And so I think it's important just to tell everyone that I have been proud and how serious and our players have taken this. Obviously, unfortunately, we have a number of players and staff that are on the COVID protocol list. Some are symptomatic, some are asymptomatic. I can't get into a lot of the details, as you guys know, on any of that, but I will say that. And I'm certainly happy to answer questions. There may be things that I can't get into specifics on, but certainly happy to do the best I can to give all of you the information. So just want to make sure I got that out there, and, go ahead, John.
I guess, why was that second game played, and how much was this might have been avoidable if it hadn't been?
Well, I think from my standpoint, John, it's important to back up a little bit from that. I did have a conversation on Saturday before the game with Bill Daly, and asked some questions around exactly what the situation was and with New Jersey and where we were at. And based on the information that he was given, the games were decided to be played, or the game on Saturday was decided to be played. And another thing I think it's important to mention, John, is that there's a lot of people involved in these discussions. It's really being run by the experts, the doctors, the league doctors, the NHLPA doctors are heavily involved, team doctors a number of times, the specialists, the experts. And I've certainly been reminded a number of times this week that I'm not a doctor. So it's important to note that as well. But from the information that was at that point presented Saturday, the comfort was that we should move forward and play the game. On Sunday, I can't really say from my standpoint, I didn't have any information, nothing had changed that I was aware of. So anything that's come out or that's been reported, certainly, and where I was, didn't know anything. So, but I still think it's important to note that the league, the doctors, everybody's doing everything they can to handle this as it's ever changing and evolving, and nobody's doing anything that puts the players in a position where they don't think they should be. It's just they're making the best decision they can in the moment. And then I think what you're going to see is that there's a lot of learning going on. And what happens, will we learn from our situation? Will the league learn and make changes as we go? That's likely.
Hi, Kevin. Did any players express concern to you or anybody in the hockey ops department when it came to that second game? Because they did add a player to the list before that game who had traveled to Buffalo, who had been with the team on the bus. So just curious about that at this point.
Yeah, you're talking about the second game, Lance, right? The Sunday game. Yeah, not that I know of. I was not aware, our coaches weren't aware. I don't believe that anyone knew going into the game Sunday that there was any sort of change. Obviously, going into the games, it was known that the player on their team either had, was in the COVID protocol. So, all this, there obviously is questions, and that's why I had the call on Saturday, just to ask some questions and make sure I check in. But no, none of that was brought up on Sunday.
Hey, Kevin, Adam Bonini, I guess you mentioned learning, that everyone's learning in the process, and it's not unlike what other sports have gone through. Obviously, when you look at how Major League Baseball started out with this, what the NFL dealt with during the course of the season. But it seems to me, from everything I've read and heard, that at the crux of this is the faulty assumption that in-game transmission wasn't going to be an issue. Is that correct? And is your view of that, and to what extent you can tell us your discussions with the league, has the overall kind of view of that changed based on what's happened here?
Yeah, it's a fair question, Adam. I think let me say again that it's probably important that I'm not the one that's an expert in this area. I'm not a doctor, and you know the fact of the matter is there's a lot of people from the NHL, the NHLPA, the teams that are having these discussions, and I think as I said before, there's learning going on. Now, we hadn't had any cases. Our players have been incredibly disciplined. We come into a situation where potentially it was in the New Jersey locker room, and now, you know, where we are. So there's certainly the ability to connect the dots, but I don't want in any way to it where I'm saying that it's happening on the ice. I think we have to let time play out. We have to let the contact tracing play out. We have to let the doctors be the experts, and then we'll know. And as soon as that information is shared, you know, I'm sure it'll come back to the organization. And I will say the communication has been excellent with the National Hockey League. I mean, I've had daily calls with Bill Daly, constant communication. There's been, you know, everything's been shared and transparent. And there's also a number of calls that I get brought into later that the doctors have discussed certain situations, what's going on. And then, you know, I get the kind of the notes after that. So there is a lot of work being done behind the scenes to make sure they're doing everything they can to keep the players and the coaches and the staff safe.
Hi, Kevin. We understand the situation about what you can and can't say about the players. The organization announced Ralph had a positive case. What can you tell us about his health status at this point, and how are you moving forward with the coaching on this club if he's going to be unavailable when you start playing games?
Yeah. So, you know, the reason we did get that out there about Ralph in particular was he was comfortable with that. You know, as you guys know, the rules around the players, whether it's they just were close contact or they're, you know, we're not giving that information out. But Ralph is symptomatic. He is, you know, I've talked to him multiple times every day. I feel very comfortable that he's being looked after from our doctors and trainers. We'll have to see yet where we go from here as we get into next week. We certainly hope that Ralph's asymptomatic and comes out of the protocols and he's ready to go when we play our next game. But I'm not quite ready to get into that yet because we'll have to just see where Ralph is. But as soon as I have a little bit more information, I definitely will make sure we present that to everyone.
Kevin, we've seen the team statement as well as your statements here regarding repeatedly saying you feel the players and the team and staff have really adhered to the protocols here. So where does your level of frustration sit where it seems, and you can correct me if I'm wrong, that you guys feel as an organization you've done everything in your power to avoid something like this?
Well, I think you have to be careful a little bit on the word frustrated. Like, we are in a incredibly challenging situation worldwide, and this is evolving, it's changing. There's different strains. I mean, everybody is doing their best to manage this and keep up. I think the important part is learning and understanding what happened, which we still don't have all the information exactly kind of how this all played out. And then to me, you have to be careful with that word because it's about moving forward and how do we not let this happen again? And what can we do differently? What can anyone that was involved do differently? And then how do we rally around this as a team? What's critical here, and this is something that I've you know, had a conversation just recently with the team about is this is about us rallying together and bringing ourselves as a group into caring about each other and saying, man, these guys that aren't with us right now, we gotta support them. We gotta get healthy. We gotta, you know, really pull together in this fight as a Buffalo Sabres organization together and our, you know, our fan base, and just kind of use that. So that's what I'm more interested rather than kind of looking back and being frustrated or upset. It's more about let's move forward and let's do this together.
Kevin, with some of the new protocols, including having the spacing in the locker rooms, how are you going to accomplish that? Your locker room, I can see it happening. The visiting room is going to be very difficult. Are you going to have to open up more rooms on that level so you can have more spacing for the two teams?
Yeah, Paul, it's a you brought up a point that many people overlook. It's one thing, a lot of the home facilities and the home dressing rooms, the ability to space and to do things that you can. The road is the challenging part, right? Like you've been in Washington's locker room, you know how small that is. Like, so what is going to happen? We're going to adhere to every single protocol that the NHL puts in front of us. We've already done some of that, and as to prepare for this day to be ready. We all want the same thing. We all want our players to be safe. We all want our staff to be safe and healthy. But you're right. It's not just about the home locker room. It's what happens when you go on the road. What other measures can you take, and what other measures the organization takes? So, as recently as a couple hours ago, I talked to our equipment manager to ask, okay, so what are other teams in our division doing, and how are we not just worrying about ourselves at home, but what's being done when we go on the road? So we owe that to each other. We owe that as a National Hockey League, as a group. We owe that to each other and within the group, to make sure that we're also putting players that come into our building in the best possible position to stay safe. So it's a great question, Paul, and I don't have a great answer, but we're working on what we can control right now and doing that here in our arena, and then we'll go from there.
Kevyn, John Worrell with the AP. I'm glad to see that you're safe, given all that's going on. I've got a bit of a two-part question. The first is whether the NHL has informed teams or yourself that you're going to have to prioritize winning percentage points, or if that's going to become a possibility, and whether you've shared that with your players. And the second would be, based on the discussions you've had with the NHL and the experts and what you know now as opposed to what everybody knew back then, do you think what you know now, would that game on Sunday have been played today?
Well, I'll start with the first question, John. I think we are, as I said, this has been daily conversations. As of now, the goal of the National Hockey League is to play the entire season out, our schedule out, every game out. And we are preparing for that. And we're also preparing our players mentally, that just because now we've been off for a little while, it doesn't mean the season goes longer. It means the grind actually picks up. And how do we do that? And how do we work through that together? So we'll certainly adjust if we're told. But right now, John, we've never been mentioned to me or anyone in the organization about anything other than a 56 game schedule and going from there. And sorry, what was your second question?
Based on what everybody knows now, in hindsight, would that game, how much did the NHL and maybe the Sabres learn from what happened, and would that game have been played today based on what everybody knows now?
Yeah, John, it's a really tough thing to answer. I think we're learning, and I do know that the tracing that goes on to say, okay, what are the different strains out there, and what's the science behind it? I don't think a lot of those answers or those questions have been answered yet. And I'll say this again. Sometimes, especially with this virus, it feels like when people, the experts, have got a handle on it, it changes quickly. So based on, what we learn, would they go back and say we would have done something different? Possibly. But I think based on everything that we've been told, and I promise you this, we all want the same thing. We all want our players to be safe, healthy, to get through this and to eventually get fans in the buildings and get back. But I think everybody's doing their best to work together on that. And again, I want to drive the point home that a lot of us that are involved in the hockey ops or from the league perspective, we're having a lot of conversations, we're learning, we're getting information, but it's really the medical and the experts that are the ones driving a lot of these decisions. And that's what it should be. They're the ones that understand the most. And so we're leaning certainly on them heavily.
Kevyn, could there potentially be a promotion if Ralph misses any time to the coaching staff, or could there be some sort of change there to someone to fill in?
Yeah, I think it's premature to get there, because we're just going to see where we're at here. I think again, let me say this. We're all making sure that we're trying to do everything we can to keep each other safe, and Ralph Krueger is being looked after. And we want to just start with that. So if he is where we need him to be and he's able to get out of the protocols and be back, then he will be. And if he's not, the doctors are going to decide where and when that happens, we'll adjust. So what we will do is we'll do it together. The players will understand exactly why decisions are made, and we'll react accordingly, and then we'll move forward together. But and then obviously any information like that I would share, and we'll get back in front of all of you at the appropriate time. But right now we're just making sure that we're supporting Ralph and hoping that he gets back quickly.
As you said, you're learning a lot, and there's other teams right now that are learning a lot. You said the hope is to have a full 56 games. Given what you know and what other situations are, do you think that's possible for the league to have a full season this year?
Well, so I think based on what you saw in other sports, John, as the NHL went into this season, they certainly were understanding that this could have happened, right? And potentially building in a little bit of time if games needed to be pushed in a little bit on the back end. We'll see. Obviously, you guys saw what happened with the 4 games that were originally postponed. It's not as simple as just plugging 4 games in. It completely changed the schedule, but it didn't back it up. So if I'm not sure how much the NHL would want to push those games into May. But I do know from conversations with Gary Bettman and Bill Daly, it's critical that they feel the integrity of the season is there, and so that's not been brought up to myself or anyone else in our organization about anything different than 56 games. But we'll react. If that changes, we'll adjust, and we'll do our best to move to the next whatever we're told to do.
Kevin, what are you hearing and feeling from your players? How worried are they?
Yeah, that's a great question, Brian. And I'm glad you asked that, because the first thing I thought of when, the news kind of all started, whatever it's been now, a week or a little over a week ago, was, how do our players feel? What are they thinking about? And, where are they at mentally? And obviously over the last week, I've had a lot of conversations and talked to players and checked in with them. And I believe the spirit of our group is really, really good right now. They're certainly worried and care about the players that potentially, are, whether, like I said earlier, it could be symptomatic, and they wonder and they're hoping and checking in with them. But just being now allowed in the facility today, this is our first time back, as you all know, based on the doctor's kind of advice and where we're at with all the testing. The spirit of the group is really strong right now, and I sense a relief to be back in our building and to be able to go on the ice and practice. And I also sense a opportunity for this group to pull together and to say, okay, this is challenging. This happened. It's unfortunate, but we're going to rally together and do, go to work. And part of the message to the group that I had was certainly don't expect anyone to feel sorry for us. We have to get through this, and we have to do it together.
Kevin, you mentioned in your opening remarks that you had some staff involved also. I'm assuming that's, hockey related staff. Do you have, 2 people in protocol or 20? And then my other question would simply be, do you have to consider taking Donnie Granato off the bench because of what he went through, 14 months ago?
Yeah. So I'll start with the second question. Donnie Granato or anyone else, to me, safety and caring about the people is extremely important, way more important than trying to figure out anything on the ice. We have to look after our staff. We have to look after our players. We have to support them in every way. So I've had some just real honest conversations with Donnie. I know that Ralph has as well, and we're going to kind of see how this plays out over the next few days. But he's an incredibly important part of our staff, but he also can do a lot of his job in other ways. So do we see if he goes upstairs and not behind the bench? We'll make those calls as we get closer, but ultimately it'll be us supporting Donnie to what he feels the most comfortable with based on, what he's been through in the past. And in terms of other staff, honestly, Mike, I can't get into it, but I can just say that there is staff as well as players in the COVID protocols. But, this is a small group, and, how the group of players, you have a lot of different people that that are doing different jobs. So it is hit more than just the COVID protocols have hit more than just the players.
Kevin, what gave you the comfort to allow your players to come out of quarantine today and to get on the ice? I mean, you have to be comfortable with it. They have to be comfortable with it. What gave you that comfort level to allow them to get back out there today?
Yeah, it's a great question. The doctors ultimately gave me the comfort that based on the science and based on the contact tracing and exactly when positive cases had come out or close contact cases had come out, that they were comfortable. If the PCR test from yesterday and the POC test, I'm learning a lot here, Paul, with all my POC test from today came negative, which everybody took early this morning, and that was the case, that they felt comfortable opening the facility. And the original guidance was that we potentially could have practiced last night even, but we felt like let's give this one more day to just be even that much more err on the side of caution. But I do feel, based on all of that and the evidence and the science, that we are comfortable opening the facility and practicing today.
Hi, Kevin. This is Guillaume Lefrançois in Montreal. I know you were asked earlier if it's realistic to aim for a fixed 56 game schedule, but I was just wondering, how realistic is it with no additional measures, given, I guess, the spread of the virus in the general population? Because you have players, you have staff who have family members, who have kids who are in school, and I'm just wondering if you see any additional measures that can be taken to sort of guarantee that you do play a full schedule.
Yeah, I think it's a good point. I think what you've seen in other leagues, if you followed it close, is they have learned and changed protocols and measures as they've gone along in season. So we're certainly seeing that right now. Will it look different in a month from now? Potentially. I can tell you that, when there's pretty strict protocols right now. When we're on the road, you're not really leaving your hotel room. You're really tight with certain things you're allowed to do. But you bring up a good point. There's the people around the organization. When you're at home, many players, many staff have families. Your families are doing certain things. So it's what we're in. And will it evolve and change? Likely. But I do think that the NHL is going to do everything they can to keep up with that, to make the proper adjustments based on the science behind it, and then do everything they can to get the full schedule in.
Hey, Kevin, before the last two postponements, you guys were playing something like 46 games in 86 days. I mean, virus concerns aside, that's going to take a mental and physical toll on your team. I mean, what's your level of concern about, there's some weeks where you're playing 5 games, there's travel involved. Your thoughts?
Well, we're all in the same boat, Lance, honestly, like across the entire league. It's definitely going to be a grind. I think part of it is to lean on our sports performance staff. What do the players need to be at optimal, for the game time? What do we do in between days? How do we travel to help the players, recover? What can we do? Can we tweak our travel just to do little things to help in any way? That we're going to look at all of that. And then we've said from day one of training camp to the entire organization, guys, this is a unique situation. Nobody's going to make any excuses in this organization. We have to go out and we have to be mentally prepared to compete every night. But we also talk to the entire organization about, we may need more players. We may have a situation where we need to pull guys up from Rochester to the taxi and just have everybody be ready to go. So, obviously we'll make that, assessment over the coming days. But I think the message has been clear from day one of training camp, and, we'll see. It's tough though. It's as a player, sometimes people don't understand that it's not just you show up and play a game at 7 o'clock. There's a lot that goes into it, and we're going to ask a lot of our players, but we're also going to support them. And I told the players today, we are in this together, and we're going to do everything as a staff, as a coaching staff, our support staff around the team, to give them every opportunity to have success. And that's all we can do right now.
All right, we're all set. Thank you, Kevin.
Okay, thanks guys. Stay safe, everyone.